I'm Aggie Kerwin. I'm on the Contingent Media Team, and I'm joined by Dr. Jensen. Can you please tell me your role for this year's World Jamboree?
All right. Thank you so much for having me, Aggie. My name is Paul Jensen, and I'm going to be working with a team of one other doctor, a nurse, and a physician's assistant. And the four of us are going to be the United States Contingent Medical Team. This information is for general use. Please ask your provider specific questions. I am not licensed to practice medicine in 47 of the 50 states, and I don't pretend to. So please consult with your physician, your physician's assistant, your nurse practitioner. The first medical, I guess you could call it a document, is the registration to join the Jamboree. The second is every member of the United States contingent, whether adult or youth, also needs an updated copy of the BSA health and medical form. Controlled substances are medicines that are controlled specially by the government. These would include pain medicines, narcotics, anti-anxiety medicines, stimulant medicines for ADHD. In our last Scouts and Parents Guide, we included information that we hoped that the Korean government would let us file for a single permit for the entire United States contingent. Unfortunately, that is not going to be the case. Each scout and each leader wanting to bring one of these medicines into the Republic of Korea is going to have to file for their own permit. And I'm going to show you how to do that here in just a minute. One piece of good news that has come through with this, though, is that it does appear that people who are on amphetamine, dextroamphetamine, like Adderall or Vyvanse for ADHD or other conditions, it looks like those people will be able to get permits. We did a trial permit process for someone close to me, and it ended up going through the process. So we think that those people would be okay. Once again, these are medicines that we listed on the last page of that Scouts and Parents Guide. So if you're taking any of the medicines on that last page, you'll need to go through this process to get what the Korean government calls a bring-in permit. For the bring-in permit, the way you file for this is there are two forms to fill out. You will also need, in addition to the two forms, a copy of your passport, a prescription for the medicine signed by your doctor, and also a letter written by your doctor stating what the medicine is, why you take it, and has the doctor's signature on it. So it's going to require both of those, a prescription and a letter. The Korean government also would like a copy of the ticket to fly into the country. Since we're going as a group and our tickets haven't been issued yet, I'm hoping that they will allow us to just go with our flight numbers of entry into the country. I don't know the answer to that. I sent an email to the Korean Ministry of Food and Drug Safety, and I have not heard back from them yet. So with that, I'm going to share my screen with you, and I'm going to show you the two forms that we are going to need to bring in. Okay, this is the first of the two forms that the Korean government would like if you're bringing in one of these controlled substances. Just walking through this, it's called the Inbound Traveler's Permit for Narcotics-Contained Medication for Personal Use. Just a word here, the word narcotics has a broader definition than what we in the United States would consider to be narcotics. In the United States, we consider opiate pain medicine to be narcotics. This definition includes, like I said, ADHD medicines, anti-anxiety medicines, sleep medicines. Anything on that list of controlled substances are what they call narcotics here. So the first thing here, applicant's name, given name, and surname. That part is pretty easy. I would recommend it be exactly like your passport. If you have a middle name in your passport, put your middle name on this form. If you don't have a middle name on your passport, don't put it here. Next one is the passport number, exactly as it is in your book passport. Do not use your card passport here. Nationality. That one's pretty straightforward. Next one here. Length of stay abroad, right here. I draw attention to this because the permit that I filed 2 weeks ago got rejected because I did this part wrong. I thought it was, oh, month, day, year. Oh, I'm going to be in Korea for 18 days, and I wrote 18 days right there. That's not what they want. They want the day the month you enter the country, the day you enter the country, the year you enter the country, the month you leave the country, the day you leave the country, the year you leave the country. For most of our scouts, not the IST, but most of the scouts going with the contingent, it's going to be 07 for July, 28th because you're entering the country on the 28th of July, 2023 to 08 August, 12th, the day most of you leave the country, 2023, and then the total days here being for most of the scouts 16 days. All right, the next thing, port of arrival, that's going to be Incheon. Put both the 3-letter code ICN and write out Incheon, and then the flight number, it's going to be Korean or Delta, and then what your flight number is. For visiting purposes, mark this other here, this box here, and write in World Scout Jamboree. Because we're not students, you don't need the educational reference to attach. Now, here's the place where you write in all of the medicines that you're taking. Once again, not all of the medicines, but all the medicines that are controlled. You need to write down both the brand name and the generic name and all ingredients. So if it was Adderall, you would write Adderall, and then you would in parentheses write amphetamine/dextroamphetamine. Or if you were taking Lortab, it would be Lortab, and then in parentheses hydrocodone/acetaminophen. And then they want the total dosage per day. So if you take a 5 milligram pill 3 times a day, that would be 15 milligrams a day. Next part here, some countries have an export certificate. To my knowledge, the United States doesn't have that, and so you can put not available. Your diagnosis, the reason that you have the medicines, put in your contact information, and then this declaration here that you have tested that everything is accurate. Okay, so that's Form 1. Form 2 is a little bit more straightforward than Form 1 because they write everything in red and put stars where you need to put the information. Here you put in your name, your birth date, your home address, and then down here, the reason that you're taking the medicine, once again, your diagnosis. And then here, there's going to be a place for you to list all of the medicines, once again, the brand name, and in parentheses, the generic components, the dosage, and how many you're bringing in. Once again, the amount you're going to bring in is going to be the length of time you're in Korea plus 5 days. And then write down here how it is that, say, 16 days in Korea plus 5 days for a total of 21. There are 2 places to sign this form, right here and then right here. So make sure you sign it both. Once you've collected all those documents, you then email all of those documents attached to narcotics.korea.kr, and they will process the permit for you. And if there's anything wrong, they will reject it and tell you why they rejected it. They say this takes a minimum of 10 days. I would strongly recommend that you get started right away. And so if there are any hiccups, you have time to get it corrected.
What specific resources are there for mental health?
That's another great question, Aggie. The first thing that I want to emphasize with regards to mental health is if you are taking medications for mental health, please do not stop them. Please continue to take them throughout your time in Korea. We've talked about that some of these mental health medicines do require an extra permit. Get the extra permit. Don't stop these medicines before going to Korea thinking it will make things easier. You don't want to have a mental health crisis while we are in Korea. So please keep taking the medicines. That's first and foremost. The United States contingent has 2 chaplains, Dr. David Briscoe and Reverend Nathan Williams, who will be going with us. And their role is like the four of us on the medical team to support the mental and spiritual health of the United States contingency. So they are going to be out in the camp. They are going to be available to help and counsel you as needed. There are going to be a series of 6 special clinics, which are called listening ear clinics. Now, the listening ear clinics are clinics set up throughout the camp, staffed by volunteer counselors who are there to support the Jamboree. And so if you're dealing with issues like homesickness or stress or poor sleep or relationship issues in your unit, that would be the next step of places you could drop in and talk with a trained counselor. The last is that at the Jamboree Hospital, which will be right in the center of the camp, there will be psychiatrists. So if you need any medication adjustments, the psychiatrists are available there. It's going to be hot. It may be a little bit cooler than the summit was in 2019. That being said, there is no shade. There is one tree on the entire grounds. We are going to be in the sun. Our Korean colleagues have told us that they are going to be setting up covered walkways to provide some protection, but it's going to be hot. So I would always have your hat with you, always have sunscreen with you so that you're not getting exposed as much to the sun, which can both lead to sunburns as well as heat-related injuries. Now, with heat-related injuries, you need to stay well hydrated, okay? You need to be drinking enough that your urine is a light straw color. You don't want it clear, and you don't want it dark yellow, a light straw-colored urine. Everybody's a little bit different about how much water they should be drinking. I would say 2 liters would be on the low end, and up to a gallon, depending on what you're going to be doing. There is a myth among scouts that if you stay well hydrated, you will not have heat problems. That is not true. I want to dispel that myth. If it is hot enough, you can get heat exhaustion and heat stroke, even if you're very well hydrated. I don't think it's going to be hot enough in Korea to do that. But critically also, if you are exerting yourself, you're playing sports, you're running, even in the heats that we're dealing with in Korea, it is going to be warm enough that you can get heat exhaustion or heat stroke. And so with that, I want everyone to gauge themselves and take care of themselves and realize, hey, am I getting a little bit too warm here? Am I starting to get a headache? Am I starting to get dizzy? That's a signal that you need to slow down. The soccer game with the Brazilians can wait, okay? Take some time to cool down. And as much as possible, avoid strenuous activities like that in the middle of the day when the heat is going to be at its worst. So that's important on the heat. Also, start to adjust yourself to the heat now. Get outside. Don't spend all the time in your air conditioning. Start to acclimatize yourself so that you'll be more prepared for it when you get to Korea. That's heat. So always have your water, drink your water, always have your hat, always have sun protection.
What should everyone be carrying around with them in their day pack in terms of a first aid kit?
You're going to want something light that you can put in your day kit, realizing that if you need something more serious, that you can use the troops first aid kit, or you can go to one of the clinics or the health posts. Important things that I would say, in addition to sunscreen, hat, water, moleskin, or something to treat your feet with, or your hot spots on your feet with. I would have a few bandages with you. I would always have insect repellent with me. That's not something directly related to first aid. And then if you have any special needs, be sure to take your emergency medicines with you. If you have asthma, you should always have your rescue inhaler with you. If you have allergies, you should always have your epinephrine pen with you, or your Avicu or EpiPen, your auto-injector with you. If you have diabetes, you should always have sugar tablets or hard candy with you, as well as ability to monitor your blood sugar, so that if you get into trouble, that you will be able to self-treat yourself until you're able to get to one of the clinics or medical posts.
Hopefully meeting a lot of new people, experiencing a lot of new cultures. Is there anything besides just, washing your hands you can do to prevent these illnesses?
Oh, that's an excellent question. We're not only going to be having a camp with 40,000 of our best friends, we're going to be having a camp out with our best friends from every place on this earth. You hit the most important one. Wash your hands, wash your hands, wash your hands. In addition to washing your hands, I would also add to your first aid kit, have a bottle of hand sanitizer with you and use frequently. Vast majority is transmitted from your hands to your mouth or nose. And so keeping your hands clean, breaking that transmission is going to be very important. Also make sure that when you're cooking, that you're properly cleaning and sanitizing your equipment. I think most scouts have experience with that. We've all been taught how to do that, but we need to keep our vigilance up. Get yourself healthy now. Okay. If you're not in shape, you're going to be tired and more likely to get sick. If you're not accustomed to the heat, it's going to be harder on you. If you're not used to walking miles on end, you're going to get exhausted and more likely to get sick. So now is the time to start exercising, to start getting acclimatized, and basically get yourself ready for the Jamboree.
My last question I have for you is, do scouts need any sort of vaccination to attend the Jamboree?
Fabulous question. The one vaccine that is required by the Boy Scouts of America is a tetanus diphtheria vaccine within 10 years. Tetanus is a bacteria that grows in dirt and enters through puncture wounds. And then diphtheria is a pretty rare infection these days that's transmitted by coughing on someone. That is required. I'm going to say that there are many more that I would strongly, strongly recommend, and I'm going to go through those right now. I think it's going to be a very good idea to get the vaccines that I'm about to list, okay? First of all, let's start with our normal childhood vaccines that we're used to getting before we're 4 years old. So this includes measles, mumps, rubella. And you may say, why would I get that vaccine? We don't have measles in the United States. Well, that's true. But once again, we're having people from 150 countries. Most people get polio vaccination in childhood. If you haven't, I would get polio vaccination. Same thing with chickenpox vaccination. Most people have either had chickenpox or had the vaccine. If not, chickenpox vaccine. Hepatitis A and Hepatitis B. Hepatitis A is transmitted by, well, what we just talked about, on your hands. Hepatitis B is through blood or body fluid exposure. Most of the scouts, the youth, have been vaccinated because that's been part of the United States general vaccine schedule for more than 20 years. Maybe the leaders and adults haven't. And so I would strongly recommend being vaccinated against both hepatitis A and hepatitis B. And the CDC recommends that for all people going to the Republic of Korea. Now getting into some vaccines that maybe not everyone has had. One is the meningococcal vaccine, sometimes colloquially known as the meningitis vaccine. Really, the phrase meningitis means any inflammation of the brain or lining of the brain. So there are many different diseases. So this is meningococcus, is the one that we traditionally know as meningitis vaccine. This is traditionally given to youth in the United States about the age of 11. But once you're into that later childhood, a lot of people miss those vaccines. Meningococcal disease is not common in the Republic of Korea, but it is very common in countries that will be sending scouts to the World Scout Jamboree. So I would definitely get that. 2 special vaccines particular to travel to Korea. One is the typhoid vaccine. There are 2 flavors of typhoid vaccine. One is a pill that you take for 5 days, and one is a series of shots. There are some people who cannot get the pill for certain health conditions, and so they have to get the shot. But that's one that's recommended for everybody going to Korea, and I think would be a very good idea as well. Another one is called Japanese encephalitis. Japanese encephalitis is a disease that is transmitted by mosquitoes. It's common in southern Korea. It's common where we're going to be. The CDC's recommendation is officially that you should get Japanese encephalitis vaccine if you're going to be in southern South Korea for an extended period of time, but strongly consider it if you're going to be camping in rural areas and outdoors and not in air conditioning. We're going to be at the Jamboree at peak mosquito season and peak Japanese encephalitis season. So that's one that I would strongly recommend as well. A little expensive, I won't lie, that one's expensive. And Japanese encephalitis is a disease that the vast majority of people who get infected show no symptoms. But of those who do, it can be fatal. And so I would strongly consider getting the Japanese encephalitis vaccine. Lastly, let's talk about respiratory viruses. Our good old friend influenza. August is not flu season in the United States. We won't be having the new flu shots out probably before we go to the Jamboree. That being said, we're going to have people from the Southern Hemisphere there. And so if you have the availability to get the flu shot, it's probably a good idea. There are many places not offering it anymore because it's not flu season here. But if you have the option, that would be a good idea. And the last infection that we really need to talk about is the elephant in the room. It's COVID. The Republic of Korea just loosened some of their COVID restrictions in the last week. We know that protection either from natural infection of COVID or from a COVID vaccine lasts 3 to 6 months. If you did not have a booster last fall, I would strongly recommend that you get a booster now to make sure you're protected at the time of the Jamboree, because you don't want to get sick during the Jamboree. Certain people with medical conditions are eligible to get an additional booster from the CDC and the FDA. If you're eligible for that and it's been more than 3 to 6 months, I would recommend that you get that booster once again, just so that you've got as good a protection as you can to have the Jamboree being an amazing experience for you. For more information, we put out a health information guide in April. We are going to be adding addenda to that as we get more information. I think all of the youth got that through their unit leaders. I'm not sure that the international service team got that document. That is a helpful document that we tried to put as much information as we could think of into that document. Another point that I'd like to bring up here is that since there has been a delay in getting the annual health forms turned in and uploaded, if you have any special health needs, whether you're your youth or international service team, please reach out to a member of the medical team so that we're aware of that and we can talk through your issues with you, and so we can prepare for plans to help keep you well.